Good morning. It's 9:15 a.m. and we're just about 45 minutes to the end of daybreak. My name is Sam Gituko. Welcome back to the show. We now want to take a look at stories that are making headlines. And of course, we will be looking at the situation of the nurses' strike. Of course, yesterday the Council of Governors got some orders declaring the strike that has to end or has to take a break for at least 2 months to allow for negotiations between the county governments and the nurses' unions at different counties. Let's take a look at what's happening in Kisumu, where Laura Chieng Otieno is. Laura, good morning. What can you tell us from that county in this situation of nurses' strike vis-a-vis the interest of the counties?
Well, Sam, the nurses' strike is still on here in this county. The nurses have insisted that until their allowances are honored, then they will not be going back to work. Now, yesterday, the CEC member for health, Dr. Rosemary Obara, finally broke her silence, where she said that her department had requested for 34 million shillings in the supplementary budget as payment for allowances of the nurses. But then she said that they will have to wait for a directive from the Council of Governors before they can proceed with the payment. Now, looking at that figure, Sam, she said 34 million is the amount that they have requested for the payment of the nurses. But then looking at the first phase of the implementation of the nurses' allowances, where there was 5,000 and 3,500, that's a total of 8,500 per nurse, and for 800 nurses, that converts to about 6 million thereabout. And then they were supposed to backdate the payment of that allowance from July last year. So for 7 months, for 800 nurses, at least 8,500 will require a figure about 42 million thereabout. So we are not, or rather we will be looking for details on whether they will be paying that allowance maybe in phases, or maybe they will be slashing part of that amount, a part of the allowance amount, to ensure that it fits within the 34 million shillings, which she says they have requested for in the supplementary budget, which is yet to be tabled. So of course we cannot quite verify if that is the amount that they have indeed requested for. But then yesterday we had a spot check in various county hospitals where it painted a very grim picture, because there were empty beds and empty wards in various hospitals, various public hospitals across the county. Now, the various patients that we had managed to speak to yesterday off cuff had said that they have been transferred from their various wards, and all of them were sort of put in one ward. But then even so, the numbers were there were very few of them in the wards that we found, and they were saying that they had not received the nursing services, which usually the nurses are the ones who are going around making sure that they have their prescribed medicine, which the doctors prescribed. So they're saying they're only receiving checkups from the doctors, but then the nurses have not been around since Sunday midnight, because there were some whom we found who had been in the hospital way before the nurses' strike began, and they were saying they have not received any services from the nurses. But then the CEC for Health was also saying that they have contracted 300 private nurses to be offering services in various hospitals. But then she was mentioning areas like Ombei, which are not around town. So of course we will also be verifying if that is the situation in the various public health facilities. As she had said, the 300 nurses privately contracted by the county government offering their services. As I mentioned yesterday, the referral hospital in this place, that is Jaramogi Oginga Odinga Teaching and Referral Hospital, has some nursing services going on, where the hospital usually contracts some nurses privately. So there are a few nurses still working in that facility, but then they are complaining of exhaustion, because there are more numbers now. They are attending to more patients compared to when their public counterparts were still at work. But then as it stands, the stalemate is still on. Nurses, well, I understand they're supposed to be on the streets later on. They have not converged yet, but they're still insisting that until their allowances are remitted, then they will be downing their tools, Sam.
Right. And Laura, you said that the county government was waiting for instructions from the Council of Governors to determine whether they're going to release the money or not. And I'm just wondering, when they were signing an agreement between the nurses union and themselves, the Council of Governors was not there. So what is this obsession about getting instructions from above, yet a county is semi-autonomous, it can make decisions on itself, on its own?
Yes, Sam. You know, health was devolved, and it was the responsibility of the county government to ensure that the nurses are paid. The CEC yesterday was claiming that they had already requested for the money way back in December to be paid, and she was saying that the money was supposed to be paid to the nurses' accounts by February. So when we pushed that question to her, and she said that the Labour CS had called for mediation talks, so they wanted to withhold to see first how the outcome of those talks will be before they release the money. But then now that is where the question lies. If they had already factored in the money in the budget to pay the nurses, then why is it that they are waiting for orders from the Council of Governors? She could not quite answer that question clearly, but maybe we'll be following up to see, so that she can put it in black and white as to what their plan is exactly in the payment of the nurses, considering even the 34 million shillings which she claims they requested for the nurses' allowances seems to be falling short if you calculate backdating to July, where is the period which the nurses are supposed to receive their allowances.
All right, indeed, put it in black and white to them so that we can hear what they have to